Understanding depression and cognitive behavioral therapy. So, when we think about emotions in general, it's very common to have days where we feel blue, we don't feel ourselves. But when it starts to really impact our daily functioning, this might move to a common word that we know called depression. It is categorized as a mood disorder that involves prolonged feelings of sadness and loss of interest or pleasure in activities that were once enjoyable. It disruptively impacts one's life, causing untold suffering, and at its worst, it can lead to suicide. Globally, more than 264 million people of all ages suffer from depression. Recognizing the signs and the symptoms of depression is essential. So they can manifest as mental or physical symptoms, starting with some of the mental symptoms: persistent feelings of sadness, hopelessness, or emptiness, decreased interest or pleasure in activities that we once enjoyed, feelings of worthlessness or excessive guilt, difficulty concentrating, thinking, or making decisions, recurrent thoughts of death or suicide. And some of the physical symptoms may include changes in sleep patterns, such as insomnia, fluctuation in weight or appetite, fatigue or decrease in energy, psychomotor agitation. Never ignore these symptoms. Understand that help is available. Recognizing depression is the first step of recovery. So understanding the impact of depression is so important. Depression doesn't just affect an individual's mental state. It often causes significant disturbances in daily functioning. It affects relationships, job performance, and even physical health. People with depression may find it challenging to perform even the simplest of tasks. They may withdraw themselves from friends and family, leading to increased feelings of isolation. It can also lead to other physical and mental health issues if left untreated. Depression is believed to be caused by a combination of genetics, environment, psychology, and even biochemical factors. Changes in the brain structure or function could be involved, specifically alterations in the activity of neural circuits in the brain regions that regulate the mood. It often is thought that hormones may play a part, and some types of depression could run in families. Furthermore, certain psychological factors include childhood trauma, low self-esteem, and coping styles can contribute to the development of depression. So studies show the effectiveness of CBT. Several studies have shown the effectiveness of CBT in treating depression. According to a report published in the American Journal of Psychiatry, when compared with patients receiving typical care, CBT patients were significantly less depressed and had fewer suicidal thoughts. So what does CBT treatment look like? So there's the cognitive behavioral process, and we have mindfulness in there as well. So with the cognitive piece, it's going to challenge those negative thoughts and beliefs and replace them with more positive, helpful thoughts instead. The behavioral side of it involves learning to set up and schedule positive activities that can improve mood and combat those feelings of depression. So when we look at the mindfulness piece, these include learning to focus one's attention on the present moment, accepting it without judgment, such as grounding techniques and just being present with your surroundings and your mind. So I want to share a case study to give perspective to what you could expect from a CBT treatment. So let's say a hypothetical patient named Anna comes in. She's 28 years old and she's experiencing significant feelings of sadness, loss of interest in activities that she used to enjoy, and significant weight loss. So after diagnosing Anna with depression, her psychologist started her on a course of CBT. As part of this therapy, Anna learned to challenge her negative patterns and thoughts, engage in behavioral activation to decrease her avoidance behavior, and boost her mood. At the end of therapy, she reports that she feels a significant reduction in depressed symptoms and improvement in overall mood. Can CBT be used with medication? Absolutely. Always refer to your doctor when it comes to medication, but they can be used together. How long does CBT take? Generally, it's about 12 to 20 sessions, but it varies for each individual person. Can I book an appointment with you, or do I need a referral? You don't need a referral. You can book directly with us, and we look forward to working with you.